Hi everyone, Dr. Timothy Gallagher here again at Maragal Medical, and I'm holding an anatomical model of the knee. And this week's focus is going to be treatment options for knee pain, particularly knee pain due to arthritis. Here in New England, the weather's starting to get nice. COVID-19 numbers are definitely on the decline, and more people are becoming more active, doing a lot more outdoor activity. But what if you're suffering from pain due to arthritis in the knees? Well, this week, our medical director, Dr. Michael Marciello, is going to be talking to you about our unique approach here at Maragal Medical when it comes to treatment options for knee pain. We're going to get a lot of great information this week, so stay tuned. Take it away, Dr. Mike.
Knee arthritis. Well, aren't we all arthritic once we reach about 40 or 50 years of age? Well, not really, and obviously not. But there's a lot of causes of getting arthritic knees, and many times we want to figure that out. But if we take it to the basic aspects of what is knee arthritis, it's a degenerative breakdown. There could be a traumatic cause, there could be an age-related process, there could be a high school meniscal injury that started the process, or could just be overweight and deconditioning. But what are we seeing in the office recently? We're noticing as the weather's getting better and people getting outside, that joint is just hurting when they're trying to be more active. They've been deconditioned throughout the winter months, and then the knee starts acting up. What we want to make sure here at Maragal Medical is that we're getting to that root cause to try to figure out where the problem may be stemming from. You might have flat feet, so we look at a foot scan to see if the angle of your foot and maybe need an orthotic to help correct the position of your knee. We may think that you are bow-legged, which is a very common, again, observance to aspects of how a person gets arthritic, because one portion of the joint breaks down and then the knee starts looking like it's bow-legged because the inner side of the knee is broken down compared to the lateral or outside part. If the lateral side starts breaking down, you may actually look knock-kneed, and people tend to call it a knock-kneed arthritic process. Really, again, it's because there's asymmetry. Maybe that's because you have a leg length discrepancy, and our chiropractors will pick up the idea that one leg is longer than the other, or perhaps your pelvis is not in great position or alignment such that one side is relatively longer than the other, and it puts increased pressure on one part of the knee. So we look at all these root causes to try to determine what can we do in a different approach than the more standard way of taking a bunch of anti-inflammatory medicines, which we know for a lot of people can cause problems with their reflux or gastritis or even increase your blood pressure. And we certainly want to get away from the more traditional aspects of using cortisone injections, because we do know from the science that more and more people who get cortisone to their joints, especially like a knee joint, it actually degrades the tissue and may promote the arthritic degeneration as we age. We're trying to prolong the aspects before we have to make major changes, so certainly we won't want to give you a cortisone. We'll look at other options, such as a knee bracing with a little force to one, increase or decrease the pressure to the inside or outside part of that knee. We'll look at the aspects of your foot and the mechanics of the arches to again decide if you need an orthotic insert to help out. And certainly the mechanics of your lower back, how you're positioning, how you're standing, because that compensation when a person with a bad back or discomfort in different ways, when you're trying to walk, you may tip forward, you may lean to one side because your back hurts. Well, again, that might be driving the knee pain. So if you think about it, to treat a knee arthritis is not to treat just your knee. We want to look at your whole body. We want to get to the root cause. We want to use some newer approaches, such as a regenerative medicine injection. That actually helps restore the defects and the inflammatory processes that take place in the joint, the cartilage breakdown, the meniscal breakdown, and the inflamed joint capsule that comes along with arthritis. We are looking at it in all directions as a team approach: physical therapy, balance activities and exercises in our robotics machine, assessment of the medical choices, what you're maybe taking for medications that I may be able to change and get you off some that may be more problematic. and our chiropractic adjustments to keep everything moving freely. If we can keep you moving, if we can keep you happy, we're going to get you outside and enjoy that good weather. Give us a call. Let us do a full assessment from your back down through the legs. Make sure that arthritis isn't getting ahead of you, and get the proper diagnostic tests, such as arthritic choices of x-rays, which MRI we might be needing to better assess. We're going to look at it from all directions as a team. Give us a call again. We'll see you next week.
That was great information, Dr. Marciello. I think you all now have a better understanding of all the available treatment options that you have for knee pain. If you were ever offered a cortisone injection, you definitely have a better understanding of why that's not a good option for you. Why would you want to utilize an injection that degrades and destroys tissue when you have the option to use a regenerative injection to help repair the damage associated with arthritis? Here at Maragal Medical, we're a unique physical medicine clinic where we combine medical care, chiropractic treatment, physical therapy, all under one roof in a team environment. We have a special interest in regenerative medicine and utilizing robotics technology to make sure each and every patient gets the best care possible. And we take most insurances. If you like the information you saw today, please subscribe to our YouTube channel. More information about our practice can be found on our website at maragalmedical.com. Folks, your health is your most valuable asset, and you should be able to access that asset each and every day without limitation. Let the doctors at Maragal Medical lead you on a path towards wellness. Well, that's it for today. I wish everybody a fantastic week. I'll see you all next week. Have a good day, everyone.